Benzodiazepines are anxiolytic drugs and considered to be safer and more effective than barbiturates and meprobamate. Starting the lecture with its mechanism of action, GABA is inhibitory neurotransmitter of central nervous system. By binding to their receptors, they promote the influx of chloride ions, resulting in hyperpolarization of neuron, inhibiting formation of action potentials and decreasing neurotransmission. Now talking about benzodiazepines, they bind to a specific site different from GABA and located at interface of alpha and gamma subunit of GABA receptor. They then enhance the binding of GABA with resulting increased frequency of chloride channel opening. Increased entry of chloride ion hyperpolarizes the cell, making it more difficult to depolarize and reduce neural excitability. Next, we will discuss their uses. Benzodiazepines are used for anxiety disorders. They reduce anxiety by selective increase in GABA transmission in neurons with GABA receptors that have alpha-2 subunit. This inhibits neuronal activity in limbic system of brain. It is important to note their effectiveness for treating anxiety associated with generalized anxiety disorder, social anxiety disorder, performance anxiety, phobias, and panic disorders. Furthermore, they treat anxiety related to depression and schizophrenia. We should be careful against its addictive potential and limit use for short periods of time. They must also be used for severe anxiety rather than everyday and stress management. For prolonged treatment, longer-acting agents such as lorazepam, clonazepam, and diazepam are preferred. For panic disorders, alprazolam is effective for short and long-term treatment. There is also chance for withdrawal reactions. Next use is their function as sedatives and hypnotics at higher dose. This is mediated by alpha-1 subunit of GABA type A receptors. Benzodiazepines reduce the latent period for onset of sleep and increase the stage 2 of non-rapid eye movement sleep. So both slow wave sleep and REM sleep are decreased. To treat insomnia, the action of drugs should be considered to balance the sedative effect required for sleep with residual sedation upon awakening. The drugs include short-acting triazolam, which is used for individuals with difficulty falling asleep, but there is high risk for withdrawal and rebound insomnia. Next, we have temazepam, intermediate acting, used for individuals who face difficulty staying asleep and frequently awaking in between sleep. It should be given 1 to 2 hours before bed. Estazolam is also intermediate acting. Then we have flurazepam, clozapam, long acting, but it is rarely used due to excessive sedation and accumulation of drug. Now, next use is for anterograde amnesia, which is the temporary impairment of memory, ability to learn and form new memories. It is also mediated by alpha-1 GABA type A receptors. These include short-acting agents used before anxiety-provoking procedures such as endoscopy, dental procedures, and angioplasty. It results in conscious sedation as the patient is responsive to instructions during procedure. Drugs include midazolam. Fourth, we have their use as anticonvulsant. Lorazepam, diazepam are drugs of choice for status epilepticus. Clonazepam is used as adjunctive therapy for seizures. Drugs include chlordiazepoxide, chlorazepate, lorazepam, diazepam, and oxazepam are used for acute treatment of alcohol withdrawal, reducing the risk of withdrawal-related seizures. Lastly, we have their use as muscle relaxant. Diazepam is useful in treatment of skeletal muscle spasms and in treating spasticity from degenerative disorders such as multiple sclerosis and cerebral palsy. Before we move towards the adverse effects of benzodiazepines, there are also some important points you should know that they are lipophilic, rapidly absorbed after oral administration. They penetrate into central nervous system. They should be avoided during pregnancy as they cross the placenta and depress the CNS. Nursing infants are also at risk of exposure to drugs in breast milk. About the duration of action, I have used terms earlier: short, intermediate, and long acting groups. Long acting have longer half lives of more than about 1 to 3 days and include following drugs. Intermediate have half-life of 10 to 20 hours, while short-acting have half-life of 3 to 8 hours. But it is important to know not all duration depends on half-life. Factors like receptor dissociation rates in central nervous system and the distribution to other tissues play a role as well. Adverse effects of benzodiazepines include drowsiness and confusion as the most common complaint. Ataxia occurs at high doses, affecting fine motor involving activities. There is cognitive impairment with disruption of retention and recall. Monitoring and avoidance is recommended for patients with liver disease, alcohol, and CNS depressants enhance their sedative hypnotic effect. Last, prolonged use results in physical and psychological dependence, presenting with withdrawal symptoms with discontinuation. Triazolam, which is more potent and rapidly eliminated, have more frequent and severe withdrawal symptoms, while flurazepam is less and slowly eliminated, less associated with withdrawal. I hope you find this lecture helpful. We will be discussing barbiturates in the next video. Make sure to like, share, and subscribe. Leave your questions below.